Hello, this is Dr. Manish Chaturvedi along with my colleague Dr. Sudhanshu Raut, and today we are going to show you the dissection of the brachial plexus. So look at here, this is the pectoralis major muscle, this is the pectoralis minor muscle which crosses the axillary artery. After reflecting the pectoralis minor muscle and after dissection in the axilla, I am able to show you the different chords of the brachial plexus and their branches. You know that the brachial plexus has two parts, the supraclavicular part and the infraclavicular part. The supraclavicular part of brachial plexus consists of roots and trunks, and behind the clavicle, these three trunks, upper trunk, middle trunk and lower trunk, they divides into anterior and posterior divisions. And you know the anterior division of the upper trunk and the anterior division of the middle trunk, they unite and they form the lateral cord of the brachial plexus. The anterior division of the lower trunk, it continues as the medial cord of brachial plexus, and the remaining dorsal divisions or posterior divisions of these three trunks, means upper trunk, middle trunk and lower trunk, they unite and they form the posterior cord of the brachial plexus. You know the name given to these cords according to the relationship of these cords with the second and third part of axillary artery. So the cord which is lateral to the second part of axillary artery is the lateral cord of brachial plexus. The cord which is medial to the second part of axillary artery is the medial cord of brachial plexus, and the cord which is posterior to the second part of the axillary artery is the posterior cord. So now I am showing you the different cords of the brachial plexus and the different branches from these three cords of the brachial plexus. So now look at here. First, I would like to show you the vessels of the axilla. You know this is the axillary vein which lies medial to the axillary artery. So this is the axillary vein. You can see here, this is the large axillary vein here, and lateral to axillary vein, this is the brachial, this is the axillary artery. You can see here, this is the axillary artery. This is the axillary artery. So this is the axillary vein medial, and this is the axillary artery lateral to the axillary vein. Now, as I told you, the different cords, means lateral, medial and posterior, they are in relation to the second part of axillary artery. So this is the second part of axillary artery behind this pectoralis minor muscle. So this is the second part of axillary artery. You can see here, this is the second part of axillary artery here. This is the second part of axillary artery here. So lateral to this second part of axillary artery is the lateral cord of brachial plexus. And you know the branches of the lateral cord of brachial plexus, we remember by the mnemonic LML. L means the lateral pectoral nerve, M means the musculocutaneous nerve, and L means the lateral root of median nerve. So you know the first branch of the lateral cord of brachial plexus is the lateral pectoral nerve. This is the lateral pectoral nerve. This is the first branch of lateral cord, and this is the lateral pectoral nerve. You know this lateral pectoral nerve, it pierces the clavipectoral fascia. This is the location of the clavipectoral fascia, because you know the clavipectoral fascia extends, it is a thick sheet of fascia which extends from the upper border of the pectoralis minor to the lips of the subclavian groove. And so this lateral pectoral nerve, it is piercing the clavipectoral fascia here, and it supplies the pectoralis major muscle. So this is the first branch of the lateral cord of brachial plexus. The second branch of the lateral cord is the musculocutaneous nerve. You can see here, this is the musculocutaneous nerve. It is a very thick nerve. This is the musculocutaneous nerve here. This musculocutaneous nerves can be identified by the fact that this musculocutaneous nerve pierces the coracobrachialis muscle. So this is the coracobrachialis muscle, you can see here. And this coracobrachialis muscle takes origin along with the tendon of the short head of biceps brachii from the tip of the coracoid process. So here is the tip of the coracoid process, and the coracobrachialis muscle taking its origin along with the short head of biceps brachii from the tip of the coracoid process. So this is the musculocutaneous nerve which is piercing this coracobrachialis muscle. You can see here, this is the coracobrachialis muscle, and I can show you it is piercing this coracobrachialis muscle. You can see here. Look at here. This is the musculocutaneous nerve which is piercing this muscle. You can see here. This is the musculocutaneous nerve. It is piercing the coracobrachialis muscle. This is the second branch from the lateral cord of brachial plexus. The third branch is the lateral root of median nerve. You can see here, this is the trunk of the median nerve. This is the trunk of median nerve, and it is forming by two roots. This is the lateral root, this is the lateral root, and this is the medial root. So here are the three branches of the lateral cord. One is the lateral pectoral nerve, this piercing the clavipectoral fascia and supplying the pectoralis major muscle. Second is the musculocutaneous nerve. It is a thick branch. You can say this is the most thick branch of the lateral cord of brachial plexus. It piercing this coracobrachialis muscle. And third branch is the lateral root of median nerve. This is the median nerve, and this is the lateral root of the median nerve. So these are the three branches from the lateral cord of brachial plexus. Now the medial cord of brachial plexus lies medial to the second part of axillary artery, and you can see here the first branch of the medial cord is the medial pectoral nerve. You can see here, this is the medial pectoral nerve here. You can see here, this is the medial pectoral nerve here. This is the first branch of medial cord. It supplies the pectoralis minor muscle, and after piercing the pectoralis minor muscle, you can see, after piercing the pectoralis minor muscle, it also supplies the pectoralis major muscle here. Okay, here. So this is the first branch, medial pectoral nerve. The second branch is the medial root of the median nerve. You can see here, this is the second branch. This is the medial root. This is the medial root of the median nerve. This is the median nerve. The third branch is the medial cutaneous nerve of arm. It is the thin branch. You can see this is the medial cutaneous nerve of arm here. And this medial cutaneous nerve of arm is having one communicating branch from the second intercostal space. You can see here, this is the intercostobrachial nerve from the second intercostal space, and it is the undivided lateral cutaneous nerve of the second intercostal nerve. This intercostobrachial nerve, it passes through the floor of the axilla. You can see here, this is the fat in the floor of the axilla. It passes through the floor of the axilla, and it communicates, you can see here, and it communicates with the medial, you can see here, it communicates with the medial cutaneous nerve of arm. It is having great clinical significance. Sometimes when patient is having pathology in the second intercostal space or in this area, then patient can complain the referred pain in the upper medial part of the arm, because you know this anatomical fact, this intercostobrachial nerve, which is the undivided lateral cutaneous branch of the second intercostal nerve, it communicates through the floor of the axilla to the medial cutaneous nerve of arm. So it is a perfect example of the referred pain. Now the fourth branch of the medial cord of brachial plexus is the medial cutaneous nerve of forearm. It is comparatively thick than the medial cutaneous nerve of arm. This is the thin medial cutaneous nerve of arm, and this is the comparatively thick medial cutaneous nerve of forearm. And the fifth branch of the medial cord of the brachial plexus is the ulnar nerve. You can see here, this is the ulnar nerve. This is the ulnar nerve. You can see here, this is ulnar nerve. So the branches of the medial cord of brachial plexus are M4U. We try to remember these branches by this mnemonic M4U. 1M means medial pectoral nerve. Second is the medial root of median nerve. Third branch is the medial cutaneous nerve of arm, and fourth is the medial cutaneous nerve of forearm. And U stands for this ulnar nerve. So these are the 5 branches. I am again showing you all these 5 branches here. This is the first branch, that is the medial pectoral nerve. This is the second branch, the medial root of median nerve. You can see here. This is the medial root of median nerve. This is the medial root of median nerve. Third branch is the medial cutaneous nerve of arm, which communicates with the intercostobrachial nerve, which is the undivided lateral cutaneous nerve of second intercostal space, second intercostal nerve. This is the medial cutaneous nerve of forearm, and this is the ulnar nerve. So these are the 5 branches from the medial cord of brachial plexus. This is the ulnar nerve. Okay, it passes behind the medial epicondyle of humerus. Now the branches from the posterior cord are, we can remember these branches by the mnemonic ul nerve. U for upper subscapular, L for lower subscapular, N for nerve to latissimus dorsi or thoracodorsal nerve, A for axillary nerve, and R for radial nerve. So I am going to show you these 5 branches, means the upper subscapular. You can see here, this is the subscapularis muscle here. This is the subscapularis muscle here. You can see. Now I am going to show you the different branches. Now I am showing you the different branches of the posterior cord of brachial plexus. As I told you, the branches of the posterior cord of brachial plexus can be remembered by the mnemonic ul nerve. U for upper subscapular, L for lower subscapular, N for nerve to latissimus dorsi, which is also known as thoracodorsal nerve, A for axillary nerve, and R for radial nerve. So first you see here, this is the subscapularis muscle in the front of the scapula. Now the upper subscapular nerve, you can see here, this is the upper subscapular nerve here. It supplies the upper part of the subscapular nerve. This is the upper subscapular muscle. This is the subscapular nerve supplying the upper part of the subscapularis muscle. Then second nerve is the, you can see here, the second nerve is the, this is the nerve to latissimus dorsi. You can see here, this is the nerve to latissimus dorsi. Look at here, this is the nerve to latissimus dorsi here. You can see this is the nerve to latissimus dorsi or thoracodorsal nerve. Then the third nerve is the lower subscapular nerve. You can see this is the lower subscapular nerve. This is the lower subscapular nerve. This one. Then this is the axillary nerve. You can see here. This is the axillary nerve. And this is the continuation of the posterior cord as the radial nerve. So this is the radial nerve. Again I am showing you, this is the upper subscapular nerve here. This is the thoracodorsal nerve or nerve to latissimus dorsi. You can see here, this is the thoracodorsal nerve or nerve to latissimus dorsi. And you see very clearly here, this thoracodorsal nerve or nerve to latissimus dorsi, it accompany the thoracodorsal artery. You can see here, this is the thoracodorsal artery, this is the thoracodorsal artery, and this is the thoracodorsal nerve. And you can see this thoracodorsal artery is coming from the largest branch of the third part of axillary artery, that is the subscapular artery. The subscapular artery divides into 2 branches, the thoracodorsal artery, which is the continuation of this artery, and this is the circumflex scapular artery. And you can see very clearly this thoracodorsal branch of the subscapular artery accompanying by the thoracodorsal nerve here. The third nerve is the lower subscapular nerve. You can see this is the lower subscapular nerve. Okay, this is the lower subscapular nerve. And this is the, you can see here, this is the axillary nerve. This axillary nerve passes through the quadrangular space along with the posterior circumflex humeral vessels. It binds the surgical neck of the humerus and it supplies the deltoid muscle, and it divides into the anterior and posterior division. The posterior division of axillary nerve also supplies in its course to the teres minor muscle also, and this posterior division of axillary nerve having pseudoganglion, the region is unknown. This axillary nerve it supplies the deltoid muscle. The posterior branch of axillary nerve supplies the teres minor muscle, and it also gives upper lateral cutaneous branch of the arm, which is the cutaneous branch from this axillary nerve. So, and this is the continuation of the posterior quadribrachial plexus. This is the thickest branch of the posterior quadribrachial plexus. This is the radial nerve. You know this radial nerve passes through the spiral groove or radial groove on the posterior aspect of the humerus along with the profunda brachii vessels, and this, after passing through spiral groove, ultimately it comes in the anterior compartment of arm in the cubital fossa. So it first in the posterior compartment of the it first in the axilla, then it comes into the posterior compartment of arm, then after piercing the lateral intermuscular septum, it comes into the cubital fossa here. Okay, so these are the different branches of the brachial plexus. There's one more important branch is the, you can see here along the lateral chest wall, this is the nerve to serratus anterior, or this is the Bell's nerve of Bell. You can see here, this is the nerve of Bell here. You can see this is the nerve of Bell. It passes deep to the fascia, and it supplies the serratus anterior muscle. It coming from the roots. Its root value is C5, C6 and C7. So this is the long thoracic nerve, or nerve of Bell, or nerve to serratus anterior muscle here. One important thing which I have shown to you, you can see here the lateral root of median nerve. You can see this is the lateral root of median nerve. The lateral root of median nerve provides C7 fibers. You can see here, these are the C7 fibers to the ulnar nerve here. You can see here, these are the C7 fibers. These are the C7 fibers here. You can see very clearly. These are the C7 fibers. Look at here. These are the C7 fibers. You can see this is the ulnar nerve. This is the ulnar nerve. And you can see here, these are the fibers of C7. Look at here. These are the fibers of C7. You can see very clearly. These are the fibers of C7. These C7 fibers, they are given by this lateral root of the, you can see very clearly, by the lateral root of median nerve. You can see this is the lateral root of median nerve, and these are the fibers of C1. They are coming from the lateral root of median nerve. They crosses the they crosses superficial to the second part of axillary artery, but deep to the medial root of the median nerve, and they continue along with the ulnar nerve. So C7 fibers are imparted to the ulnar nerve by the lateral root of the median nerve. This is the lateral root of median nerve, and these are the C7 fibers which are given by this lateral root to the ulnar nerve. You can see very clearly. These are the C7 fibers. Okay, this is very important, especially for the postgraduate students. Thank you so much.